All right, started.
Welcome and thank you all for your interest in the First Thursdays at the Marin County Law Library program. I'd like to take a moment to thank the Law Library staff for both their support and assistance in the production of these events. Prior to COVID, the Law Library conducted twice-monthly Lawyers in the Law Library clinics, and it just initiated the first Thursday program with an invitation to the Public Defender's Office. With COVID, the library was initially forced to close both programs and alter the services the law library was able to provide. Over COVID, our two law librarians and staff adjusted to the demands of the health emergency and the constraints it required. They began by offering Lawyers in the Law Library and First Thursdays online via Zoom. Those programs continue today, and our staff continues to work on outreach to the greater Marin community. Today, we're doing that by continuing collaborative efforts with the many organizations that offer free, low-cost, and sometimes even no-cost services here. The organization that we welcome tonight is the Marin County Long-Term Care Ombudsman Program. The mission of the Marin County Long-Term Care Ombudsman's program is to seek resolution of problems and advocate for the rights of residents of long-term care facilities with the goal to ensure their dignity, quality of life, and quality of care. Tonight, then, we're centering our discussion on our members of the Marin community who reside in long-term care facilities. It is estimated that California may have the most nursing home residents in the entire country. For a moment, let's consider when and how the Ombudsman's organization came into being. Congress passed the Older Americans Act, or the OAA, in 1965 in response to concern by policymakers about a lack of community social services for older persons. The original legislation established authority for grants to states for community planning and social services, research and development projects, and personnel training in the field of aging. The law also established the Administration on Aging, or the AOA, to administer the newly created grant programs and to serve as the federal focal point on matters concerning older persons. Fast forward to 1978. As a part of the Older Americans Act, the federal government mandated the establishment of the Ombudsman's program to assist residents of long-term care facilities in the safeguarding of their civil and human rights. As a result, the California Department of Aging created the Office of the State Long-Term Care Ombudsman. Headed by the state ombudsman, a position filled through gubernatorial appointment, this agency designated 35 subdivisions to provide complaint investigation and other services to the state's then 200,000 individuals in nursing homes and residential care facilities. These services were to be provided at the local level by a corps of state-certified volunteers. This brings us to Marin. Who are these people to us? First off, they're part of a federally mandated program. They're administered in Marin by the Marin County Health and Human Services, Offices of Aging and Adult Services. This group of people are both state-certified staff and volunteer ombudsmen from your own community. They provide assistance resolving problems for residents living in licensed assisted living and skilled nursing facilities. To tell them more about them tonight and the things that we do, we're welcoming Daniel Steckline, who is the program coordinator and supervisor. He works for the County of Marin, and this is in the Long-Term Care Ombudsman Program. Thank you so much, Daniel. We appreciate having you here.
Well, thank you for having me. I'm always happy to talk about our program and share information about what we do, because you never know when you might need the services of the Ombudsman program. So we're going to go over all of that information. So why don't we go ahead and get started? Let's see now that This clicker is not working. Let's try this one. Slides are not proceeding. There we go. So yeah, you already captured this part. We are mainly problem solvers for people in long-term care settings. We do a lot more than that, but it is our probably predominant role for us. Oops. So this gives you a little bit more of a timeline about our program and some of the other organizations that were working on the same problems of issues in long-term care. Starting, Medicare and Medi-Cal were created in about 1965. And that's the primary funding source for nursing homes. So there was a proliferation of nursing homes opening up throughout the country. And it didn't take long in the late 60s and in the very early 70s for problems to start surfacing. And consumer advocates like Ralph Nader and the Gray Panthers started highlighting a lot of those issues and doing studies and sharing that information with others about the problems that were occurring. A lot of the early focus was health and safety and also quality of care. So that was all happening around 1970. And some of those, the top line of this timeline here is another kind of branch of service, if you will, of advocates. We call it the culture change movement, was all a part and going on separate from the Ombudsman program. So just to highlight that just very briefly, I mentioned Ralph Nader and the Gray Panther movements. They did studies and published books, and also the National Citizens Coalition on Nursing Home Reform was created by Elma Holder, who was a part of the Gray Panthers. And she and her partner in that organization, Barbara Frank, were really instrumental on writing books and getting information out there so that other agencies, both the Institute on Aging was also integral in capturing information. They had a report called Improving the Quality of Care in Nursing Homes. And all of this led to the big Omnibus Reconciliation Act in 1987, or OBRA 87 as it's called, which was the first person-centered care regulations and requirements for facilities to not only look out for the health and safety and the quality of care for residents, but also their psychosocial well-being. So that was a new thing. And from there just a continuing stream of then providers who were heavily involved with reimagining the services that they provide. And I'm just going to briefly mention Eden Alternative. These are well known, and if you're interested, you can Google them. They incorporated Wellspring, which is another nursing home group, which were really experimenting and testing the waters in a lot of interesting new ways of providing nursing home environments, such as a lot of plants and trees and animals and children and intergenerational activities. So it just went through, and then there eventually became a group of providers and others called the Pioneer Network. And that became this agency that brought the regulatory Center of Medicaid and Medicare Services to the culture change table. And they really became involved in that process. And then later, they created the Artifacts of Culture Change, which was it's a tool for facilities to use to assess their own culture changed capabilities and how much they're adopting person-centered ways and putting the resident at the locus of decision making instead of the facility focusing on the needs of the facility. So moving forward, you have the Affordable Care Act, which provided additional fundings for studies on the culture change movement, and then culminating in the CMS final rule, which is a number of person-centered care regulations that came out, passed in 2015, and eventually started rolling out in 2016, 2017, and 2019. So I wanted to give you a brief overview of some things that were going on besides the Ombudsman program. So refocusing now to the Ombudsman program itself, yes, In California, it was 1978 when we finally got rolling, and it was originally called the Nursing Home Ombudsman Program. But it was in 1981 that they added assisted living communities into our jurisdiction, and they changed the name to the Long-Term Care Ombudsman. Some of you may be wondering, what is ombudsman? The word, it's not only hard to pronounce, it's sometimes challenging to explain, but in general, it's someone who's an advocate for somebody is the easiest way to explain it. It's a Swedish word, and I think it was used to help landowners where there weren't fences to sort of help with issues with neighboring entities having problems to resolve. So the Federal Older Americans Act is what gives us, it outlines the ombudsman program, everything that we are required and expected to do, how we investigate cases, and all of the things having all to do with the ombudsman program. And it was already mentioned, there needs to be and required to be an ombudsman program in every state, including the District of Columbia, Puerto Rico, and Guam. And that all states need to have a state ombudsman. But from there, states kind of can decide how they want to run their program. Some keep it as a more state-run operation. And where in California, we did branch out, and there's a state ombudsman who's ultimately responsible for the program throughout the state. But it is separated into 33 AAAs. There's been a little bit of consolidation from the original 35. In Marin County, we are a part of the AAA, which is housed in our county government agency. In other programs throughout the state, some have been subcontracted out to nonprofits who then provide ombudsman services, and the AAA would then provide them the funding to do so. But we are here within Marin County's Aging and Adult Services. So we are overall a part of Marin County's Health and Human Services. The next division break is at Social Services, and then Aging and Adult. The adult side is Adult Protective Services and the in-home supportive services. On the aging side, it's the Ombudsman Program and our INA team, or our Information and Assistance team, which is an award-winning group where they provide information assistance about all things related to aging services that are available for those living in the community. So they just have a wealth of information, a wealth of resources, and I highly encourage you to, their number is, will be provided. I don't know if I included that, but it's 473-INFO, 473-INFO. And of course, we have our Older Americans Act, the administration of all those funds, which is what our AAA does as well. And our program itself, I'm the full-time coordinator and supervisor. And then we have 2 staff who are full-time, and we have 1 half-time office support person. So we are a very small program in terms of staff. We typically have 6 to 10 certified volunteers. And those volunteers go through a pretty rigorous 36 hours of certification training, which is structured by the state ombudsman. And we provide it locally here. And then they also are required to do some field work and going out into facilities, initially shadowing our staff people and myself, and then eventually we shadow them before they can finally complete their training. And from that point on, we will typically assign them one or a few facilities for them to go out and providing ombudsman services, which I'll cover a little bit more in the following slides. In addition to that initial training, they also are expected to complete 18 hours of continuing education annually and contribute about 10 to 20 hours a month. And they're required to attend regular monthly trainings and meetings of our ombudsman program and others throughout the year. So I will say, if you're interested in this, you can just contact our office and we can provide you more information about it. Like I said, we had some challenges during COVID where I think we were down to 2 certified volunteers, and they are still with us. But we did have about 7 or 8 at the time. And so at that point, we had a lot of apprehension about going into facilities that had COVID, and many dropped out at that time. So the new folks, we train them, we provide them all the PPE and the knowledge of how to do it. And even then, it's up to them if they want to go into a facility that has a COVID positive case. It is totally optional, and we will cover if they can't or choose not to. So our core duties are skilled nursing facilities, and what are legally, or in terms of licensing, they're called residential care facilities for the elderly, which is the official name for assisted living. And in addition to that, we have a few what are called continuing care retirement communities, which they have both independent, assisted, oftentimes a memory care special section, and then skilled nursing as well. And lately, there's been some changes in some of our communities, and one of them no longer has a skilled nursing facility, but you go into those communities and you buy in typically, and you then have a contract where you know that you can move from one level of care to the next and not have to be worried that you may have to go somewhere else for during the course of your lifetime. So a little bit more on those, our core duty facilities, a little bit later. We have, in terms of roles and responsibilities, California is one of only 5 states where the Ombudsman program is the designated agency to receive allegations of abuse from mandated reporters regarding residents in our original core facilities, but also these facilities on the right of this slide. These are intermediate care facilities for the developmentally disabled, the adult residential facilities. Again, those are homes, group homes for the individuals with intellectual and developmental disabilities, our adult day programs, adult day healthcare programs, and any congregate living health facilities. Those are specific licensed facilities that have been selected to be a part of the Ombudsman jurisdiction. We cover that as if Adult Protective Services does for those living in the community. Since these are licensed facilities, that's a kind of a specialized environment that requires knowledge of regulations and the licensing agency and all of that. So that's why we Ombudsman program, we cover that. And we have an MOU with our APS that spells all that out so that there's no confusion. So residential care facilities for the elderly, we have 50 in Marin County. It fluctuates, facilities will open and close throughout the year, but in general, we're consistently around 49 or 50. And their other names, they're called assisted living. The small ones are called boarding cares typically, or residential care community has been the official term used by the federal government for our program. So these facilities are licensed to provide personal care. They're not licensed to provide medical care. So they do meet certain requirements for licensing to do, I would say, medical care light, which is medication management. But they are not medical providers. Even if they have a nurse on staff, they are not to be administering nursing services. It's primarily really personal care, housekeeping, laundry, meals, that sort of thing. The other thing about these RCFEs, as we call them, is that they are all private pay. They are not paid for by Medicare or Medi-Cal. So if you have a long-term care insurance policy, that may pay for it, but they are all private pay. And the price range can go from as little as maybe $5,000 a month for a shared room in just a few facilities, all the way up to more of the $65,000, $75,000, $85,000, and even up to about $12,000, depending on where you're at, the levels of amenities they offer, and the level of care that you need help with. So there is quite a wide range there. Our smallest assisted living homes we call them boarding cares. They are just converted residential homes, and they have anywhere from 4 to 6 residents in them, and anywhere from 1 or 2 personal caregivers that work there. So, and even those vary. So if you know of anybody who's looking at assisted living, you can have them call our office, and we can help them figure out, what might be the best facilities for them to contact, because some have higher staffing ratios and will care for people with higher needs. But their pricing tends to be pretty consistent. Our larger assisted living homes have a more varied pricing structure, really based on your needs. So skill, and we also, by the way, I will give you a link to our Marin County Choices for Living, which has a lot of information, the same information here, including some links of where to go for additional information for each facility. So for skilled nursing facilities, they're also called nursing homes, convalescent homes, post-acute centers. A lot of them you'll see now have the post-acute name. That's a step below a hospital, which would be an acute care. A step below that would be like a subacute, more like a Kentfield hospital, which is not a part of Ombudsman jurisdiction. So this is post-acute, where people mainly go for either short-term rehab from a surgery or a medical episode where you've been hospitalized for several nights. And you might be recovering from a fall or a broken bone or a wound or something like that. These are licensed to provide medical care. There's a medical director. There are RNs, there are LVNs, there are CNAs. They are in addition to all of the personal care that they also provide. We have 12 of them in Marin County. 2 of them are a part of a continuing care retirement community. So not necessarily open to the public, but maybe, it depends on their census at the time. And so they also range in size. So we have some that are just small, 30, 40, 50 bed, and then all the way up to like 160, 180 bed. And we also have one that's private pay. So there you only can pay with your own money or long-term care insurance. Our continuing care retirement communities, well, I do say 3 here, it's actually 2. One of our continuing care retirement communities, Aldersley, closed their skilled nursing facility. So we now have the Tamalpais and Villa Marin, which Villa Marin, you would typically buy an apartment or as you enter the independent living side, and then you would be having a contract arranged to where there would be a way to transition to higher levels of care throughout your stay there. And with the Tamalpais, I believe, I'm not sure what's happening there. I know that they may not be offering a skilled nursing facility as a part of their contractual arrangement. They have one currently, but I believe your contract may only include going from independent to assisted or memory care. But you would just reach out to them if you want more information about that. And we do have the Redwoods, which is not a licensed CCRC, but they kind of operate like one because they do have independent living, they do have assisted, and they do have skilled nursing, but you don't have a guaranteed contract to go from one to the other level of care. But you do receive some of the benefits of some of that more congregate living and interaction between those communities. So our number one role and responsibility that was mentioned earlier is we help investigate and resolve complaints. We might get those, someone might call our office, we might get an email, we might hear something from a resident or a family member when we're out at a facility making visits, which I'll talk about later. And I mentioned before, we're also the mandated reporting agency that receives them from hospitals, from psychologists, physicians who might have heard something of an allegation of suspected abuse, which would come to our office and we would look into that. We also get complaints brought to us by resident and family councils, which operate in some of these communities. So that's also a connection that we try to have with those groups as an ombudsman program. Some complaint examples would be allegations of abuse, either neglect or physical abuse, emotional abuse, sexual abuse, care issues, just simply maybe inadequate care, maybe something, a care plan is not being followed, there's lack of communication, or whatever kind of care issue may come up. A lot of people call us wanting to know about resident rights and what are the laws and regulations, what do resident rights have, what do residents have the right to do if you're in different types of care facilities. So we are the local expert on that. And we also can reach out to other organizations like the licensing agency and a few others that are good resources for information about resident rights. Financial issues are another thing that comes to our office, as well as issues about activities, transportation, going to medical appointments, social services, that sort of thing. Another key thing that we are required to do by mandates from the Older Americans Act is we make unannounced visits to both assisted living and skilled nursing facilities and our CCRCs. The very minimum that we can do is quarterly, but we prefer to do monthly and more. It really depends on our number of volunteers we have and our resources. But we try to stay around monthly, but then we have others that we visit weekly for sure, and even some several times a week. It really depends on how much is going on there, how many phone calls we're receiving, how many things we're following up on. But by law, they need to let us in. We go unannounced and we go room to room and we interview residents and see how they're doing and if they have any issues that they would like some help with. And we may just end up providing them information where they can solve the problem themselves, or if they want us to, they will give us their written consent to actually follow up and help resolve a problem by speaking to others, or maybe looking into something a little more by looking at some records, some medical records or something like that, financial records. Information and consultation to individuals and facility staff is another biggie for our program. The gold standard, as stated in the Older Americans Act, is for us to empower residents and to empower family members. And as I like to call it, teach them to fish. Although we will do the fishing for them if we have their consent to do so. So topics that we oftentimes provide individuals and facility staff are about our services, about long-term care facilities and how that all works with placement. We oftentimes get a call from someone in a hospital or a family member, and there was an unexpected incident where they were in a hospital and now they need a nursing home. And they're panicking because they say they have to pick a place right away. So we will immediately jump in and try to help any way we can. We provide information about laws and regulations. And since we are a mandated reporting receiving agency, we do provide a lot of information and training about mandated reporters' responsibilities. We also know how licensing works. So we let people know about that as another option for problem resolution. And discharges and evictions from skilled nursing facilities has always been kind of a top complaint topic, both locally and nationally. So it's always a big part of our information and assistance as well to facilities and individuals, in addition to actual helping with complaints. Community resources is another big topic that we provide information on. And we are expected to be a witness for advanced healthcare directives for residents in nursing homes. So we do know a lot about that. So again, that's something that we provide information assistance on pretty regularly. And again, Medicare and Medi-Cal, a big part of the nursing home world. So therefore, we are involved with both and know a fair amount about both. And any information that we can't provide, we will get you to the right place to learn more about that information. Care meetings are, again, mostly, nursing homes and assisted living have both the option to have a care meeting. In assisted living, it is required at least annually. And some facilities may require it more frequently, but you could also request one whenever you want. And that is basically a care meeting, is getting the folks together that have a part in your caring for you to get in one place and to go over your care plan and to make sure it's up to date, make sure it's working, make any changes and plans moving forward. It really helps improve communication if that happens. And we help people strategize either for them to attend those meetings themselves or for us then to attend with them. And same thing for resident family councils. Those are opportunities for us to if requested, we will help if they're having a problem communicating with the facility, getting things done, or if they would just simply like to know more best practices about how to have an effective resident council meeting or a family council meeting. That is something that we have studied, and we have a lot of resource information about that we can share with people. I mentioned the witnessing advanced healthcare directives. So in people in nursing homes, these are just a few more of our responsibilities. We do provide in-service trainings to facilities, such as mandated reporting is the most frequent one. I've done some on nursing home culture change, communication. We had one of our systems advocacy, which is a couple bullet points below. We did last year was we created, we met with and hired a couple of professors experts in communication, specifically for the healthcare industry. And they developed a training for us, and they actually provided the training for our assisted living and skilled nursing facilities via Zoom that we hosted. So more information about community education, resident rights, that sort of thing. And again, I mentioned that we are the agency to investigate any of the allegations of abuse that might be reported by mandated reporters. So we are not alone in being involved with mandated reporting process. Local police are one of the other components of that. Local police, their role is primarily that of addressing an urgent situation, something where there's really a danger occurring. So they are there to intervene, and they are also there to look into if there was any criminal abuse going on by anybody. So they would do an initial interview, and then they will then decide if that will be pushed on forward to their investigative unit. They're also the starting point for things to be going to the Department of Justice, our local attorney's office here, district attorney's office, our local DA. So it typically will start with the local police, and whether it's a financial abuse or a physical abuse or a sexual abuse or whatever, they will then review it and then move it up to and refer it to our district attorney's office if they believe that's necessary or appropriate. Local Department of Social Service Community Care Licensing, that's the licensing agency for all of our assisted living communities, our RCFEs, our adult residential facilities, and our adult day programs. So their main role is to initially license a facility to make sure that they meet all the qualifications to be in business. But then they also follow up as an agency to investigate whether they are in compliance with following regulations. And they actually have the power to force a facility to remedy a deficiency, whether that's a simple, if it's on the lower level scale of severity, it may be just a plan of correction would be them creating and finding a training that they need to provide for their staff or management or whoever. And then they just need to show that the training was appropriate and that they completed it. But then they also have the ability to fine them. They even have the ability to close them if it gets to that level. So it's a whole spectrum of involvement there with licensing and the facilities that they are responsible for. So they typically will go out and, post-COVID, pre-COVID, and now post-COVID, and do annual inspections as well. And I have a link later on that will show that you can go to their website, and they have not only information about what they do, but they also have information about each facility that they license. So it's called their transparency website, and you can, by following the link to their site, you can look up a facility by zip code or by name, and there they will have past inspection reports. They will have information about any complaints that they were investigating. So it's a pretty good resource for additional information about what's going on in any one facility. The same can be true for the California Department of Public Health. They are the licensing agency for skilled nursing facilities, are intermediate care facilities for the developmentally disabled, which is a medical care facility that provides care. It's not a nursing home level of care, but it's certainly a higher level of care than what you would find in their adult residential facilities, which is licensed by CCL. So we also have a congregate living health facility. We have one in Marin. And so, yeah, anything licensed by public health, those complaints would go to them and us and potentially local police. And they have the ability, like CCL does, to actually go in and force a facility to address an issue. Whereas we, Ombudsman program, I kind of forgot to mention this, but I think I'll get to it in a moment here. Our goal of our program, since we don't really have the powers of licensing to force a facility to do something, we do have the power to cross-report to them if a resident or a responsible party wants us to. But we work for the resident. That's what we do. We are a resident advocacy organization. And so our gold standard, what we're working for, is try to resolve problems to their satisfaction. And if a resident does not have the capacity to provide us informed consent as to whether they want us to resolve any issue, we would then turn to their responsible party or legal representative, which would be someone for care issues to be named in an advanced healthcare directive or a power of attorney of health. And if it's a financial matter, it would be someone named as a power of attorney for finance. It could be someone like a conservator as well. And so that may be the person that we would be working with if someone that we believe didn't have the ability to really communicate with us well enough about an issue. So those are and then of course the long-term care ombudsman program, which, let me just go one more here. There we go. So a little bit more about kind of just building on that about our program as a resident advocacy organization. We are that, and yes, we are also a designated health oversight agency. We also have that health oversight agency designation is what gives us the right to go in to a facility unannounced without anyone blocking us from doing that. We also have the right, if we have consent to the resident or responsible party, to view any records that we choose to view. We just request that, and the facilities need to comply. So again, we follow the lead of the resident or responsible party. Written consent is a big thing for our program. We have to have it if we are going to access information, whether it's financial records, medical records, or disclose confidential information for a resident. And that could be even as simple as their identity. So to kind of give you an example, if we're in let's say a nursing home and we're speaking with a resident and they said, I really would like to change my room. And can you help me with that? As we would say, yeah, we could. And maybe after finding a little bit more about what's going on, we would develop a strategy of how to resolve that problem. And if that strategy includes an ombudsman representative and going and speaking with someone like social services or the administrator at the facility, we have to have written consent. We have to have written consent because we're going to be disclosing their information to somebody. So that's to protect the resident rights. Some people are residents and family members are worried about retaliation. They're worried about, wanting things to be on their terms of what they communicate to who. And this just kind of guarantees that. It kind of locks us into being in our lane, so to speak. So again, what our standard for resolving a problem, it's not how we think it should be resolved. It's not what we think is right or wrong. It's what does the resident or their responsible party, how did they think it was resolved? That's what we strive to do. We do represent the residents' kind of systemically and individually. I know, how can you be both individual and systemic, but we do a lot of legislative advocacy, both our local program through our legislative committee for our Commission on Aging, which is our advisory group here in Marin County. But throughout the state, ombudsman programs are working independently through their program and also through the California Long-Term Care Ombudsman Association on legislative advocacy, future laws that will protect and support residents in their stay while in a long-term care facility. And then we have the state ombudsman who's also doing that as well. So we are always expected as a program, and certainly me as the coordinator, to be out there and working on systemic issues and representing the interest of residents. And of course, our gold standard is to empower residents and promote self-advocacy. So here's some more information that we just want to provide you. Our Marin County Choices for Living is something that we produce here in the Ombudsman program. It has a lot of information, not just about licensed long-term care facilities, which it does, but it also has information about independent living options. So it's really designed a brochure or a document meant for all residents in Marin County. It's a part of our Aging and Adult Services, is the agency who really funds it. So we create that every year, and it's a great place to go for information about, there's links to the licensing agencies where you can find information about facilities, and there's information about each facility. And community resources, a lot of that as well. And then there are some links here. If these slides go out, you can also just Google, very easy, CCLD. I'm sure it would come right up, the Community Care Licensing Division, or put a DSS in front of it, Department of Social Services, and it will definitely come up. And CDPH, that will get you right to their website. And the Medicare.gov is what they use. It's an amazing, well, I shouldn't say amazing, it's helpful website where you can look up facilities licensed by California Department of Public Health, by county, by each facility, and they have a 5-star rating for each facility. And they have a lot of breakdown on information such as staffing ratios, information about last inspections and visits. So again, another great resource for information about a facility if you're looking for one. And then of course, our program, we are always open for trying to be helpful. Even if it's for something that's not within our jurisdiction, we will get you to where you need to be. That's the nice thing about being here in Marin County. I just came from a coordinator conference in Sacramento where all the coordinators came from all the state. And I'm always so happy and proud to be a part of Marin County's Aging and Adult Services and our Health and Human Services, because we're since we are embedded and we're not subcontracted out, we are a really close-knit community. So we know how to connect adult protective services, ombudsman services, information and assistance, in-home support services is all a part of our community. So definitely reach out if you'd like information on any of that. And there's our number and our email. So other than that, if anyone has any further questions, just let us know.
I was curious, when the issue arises, and clearly it does around the country, for subcontracting, what does this actually constitute? Are the folks that are working, do they have any ties to the actual community, or are they hired from outside? How does that work with subcontracting?
Oh, it's a very involved process, and it's usually an organization within the county, that particular county, and it will be an established organization that has met all the standards to do that, and there's a pretty rigorous process to go through. So for an ombudsman program, to be a designated agency for that area, you have to go through a whole process with just the state ombudsman. And then you would also have to go through a whole process with your local area agency on aging, which is the agency that would be providing the funding for that program, or being that sort of in-between agency. So it's a pretty involved project.
Local.
They're
they
local,
must be local, and they must be certified. Okay.
Yeah, so there's a whole vetting process, and yeah. And I remember you asked me to maybe speak a little bit about COVID. I don't know if you still want me to, if there's any time for that and how that impacted our program, but let me know.
I would love to hear that, yes.
Yeah, so during COVID, I think some really bad news and some good news in terms from an ombudsman perspective. The local public health reached out to the ombudsman program to better connect with our assisted living community because they were not really that connected and aware of that community. So they wanted to learn more about it, and they created a task force, and they invited the ombudsman program in, and we shared with them basic information about how the structure works, what the licensing agency is like. And we ended up beginning hosting early, it was in March of 2020, we started hosting a meeting for long-term care facilities, initially assisted living, but then ultimately licensed nursing homes and other congregate living settings for public health. And so we held that meeting weekly and then monthly over time for them, in which they could get information out to our facilities about best practice for COVID prevention and response. So it was really an amazing, our local public health was just awesome. I mean, literally #1 in the country on most metrics. And I can feel pretty proud about that for our ombudsman program for helping make that connection and supporting them through that. And we held that meeting for over 3.5 years, and we finally handed it off to them to be handed off to a new team, which is their facilities team within public health. And so that was a really, I think, success story of bringing everyone together. And that's another one of those nice things about being in a close-knit facility with our county. The bad news is we were locked out of nursing, of all facilities, for a period of about 3 or 4 or 5 months, period. It was something that happened. It was, people got nervous, and then as soon as the right people found out that had happened, they went in and fixed it. But it did take several months for us to get back in. So there was a lot of concern about what was going on in facilities when nobody was around. No family, no friends, no visitors, no ombudsman program. I mean, even licensing was not really going out. So it was a concern for a period of time, but luckily we did start going back in. We got PPE, we got vaccinations, we got a lot of resources that helped us feel confident to go in there. And I don't think that's ever going to happen again, where an ombudsman is held out of facilities because of an infectious disease. We just know better now to not let that happen because of some of the things we learned about the effects of social isolation and other things that was happening during that time. The current status right now is not bad. There is a slight uptick of cases in our facilities, but nothing near what it was, and the outcomes are not as severe. And it's just right now, I would say, is manageable, but still always requires diligence. Our local public health is still meeting with facilities to this day monthly to keep them aware of what's happening, what's breaking, what's the latest news, so on and so forth. And our MOOC team, our emergency services, are also a part of that group.
What were the experiences of some of the other counties in California during this time?
Wow, that's a great question, because we had one county that was locked out by their local public health from going into facilities beyond the date where all the other ombudsman programs were allowed to go in and throughout the state. That, there is an ability of a local public health agency to create a stricter guidance than what is required by licensing or by the Center of Medicaid and Medicare Services. So I do know of one program that really, in fact, it was discussed today at our coordinator conference. So yeah, it was a challenging time. And I think it was a lot of mixed feelings for both staff and volunteers about going in, especially before we were vaccinated. before that was available. So I think there was different levels of response after we were allowed back in throughout the state. And then also there was a huge reduction in the number of volunteers, a very large reduction of volunteers. We're still recovering from that throughout the state and country for that matter.
How is the rollout of the latest vaccine going?
I have not heard of any problems. Yeah, I'm not aware of any issues with that currently. I think what's happening is just an increased, level of local public health. And I was just in a meeting with our state California Department of Public Health, and they're all about providing information and trying to counter misinformation. So they're just working hard to let people know that these drugs to treat and these other vaccinations are a tool that work and that they're there. So that's really what's happening right now. Is just a strong dose of messaging.
I had read that there were some counties that felt there was, and they weren't pointing any fingers or anything, just saying that it was a little bit slow in getting the dosages in and being able to move them through the communities. And I'm glad to hear that things are going smoothly from what you're seeing, and I thank you for sharing those updates with us.
Oh, and my pleasure.
Do we have any questions tonight? May I thank you very, very much. And we very much appreciate the opportunity to speak with you. And we would love to post this. And again, if someone watches this that's interested in the program, they should reach out to your office or a volunteer site.
Yeah, just reach out to our office. And if you're interested in volunteering or just want information about the long-term care setting in Marin, or if you know of anybody that's having a problem or would like additional information, we're here.
Thank you so much. Welcome back from your conference, and I hope you get some rest.
All right. Thank you very much.
Thank you so much.
Take care.
Have a good evening.